Hey everybody, my name is Jacob King. I'm the Director of Operations for Arte Dental. Today we are going to be going over an all-in-4 conversion. The patient's a 51-year-old male. He's been edentulous for about 6 months and has just been in a traditional denture during that time period. Before this surgery today, we did a CAT scan and also an iTero 3D scan and created a surgical guide to place these 6 implants. And when we're done with the implant placement, we are going to modify his denture, cut out the palate, and then attach it to his implants.
So we have a patient here that has an upper denture and an implant retained denture on the bottom. We did this implant retained denture about a year ago. And do you like it, sir?
Oh, great.
Can you show us? Can you remove this upper denture for us?
Absolutely.
This is an upper denture that was done. You can see it has pretty good suction, but the patient was complaining about not being able to taste his food. So what we're going to do today is we'll be placing 6 implants up on the top, and we'll screw in this as a temporary, and we'll remove the palate, and then just kind of clean it all up. So then he'll be able to taste his food, and then we'll let it heal up, and then we'll have something that's fixed, that's screwed in, so he doesn't have to take it in and out anymore. On the bottom, can you show them your lower dentures? Patients normally complain about just a lower denture without any implants, and that lower denture normally moves a lot because of the tongue and the fact that there's not much bone on the bottom. But we placed 4 implants here, so he snaps his denture in. So as you can tell, this thing does not move. Sir, can you show us how you remove this lower denture? So you can see there, it took some effort to remove that, and if you can show the camera that there's 4 implants placed with locators, and these locators snap into that lower denture. So sir, can you show them how you snap that in? Wonderful. Good deal. And now that is solid. And let's put this back in, sir. And we'll get started in just a second about the implants. Wonderful. So what we're going to do now is we're going to measure this height, because we want, after we're done with the implants, we want to make sure it's exactly the same.
Alright, so we're just going to speed through the next couple of minutes here real quick, but all we're doing is marking his nose and chin, and that way we can double check our vertical dimension after the surgery just to make sure that that did not change for any reason. In this particular case it shouldn't, since we're using the same denture, but it's still good to check. Also checking his bite.
This is our surgical guide. This was planned out with our CAT scan and our scanning machine, our iTero machine, and we had the software to plan out where these implants need to be based on the bone, the sinus, and spreading out these implants accordingly, so we can have something that's going to be fixed later on in the future. So we will replace all this missing teeth with something that's going to be screwed in. So what we're going to do today is making sure that this fits exactly how it's supposed to.
Okay, so at this point we are going to try on the surgical guide, make sure it fits nice and snug on the gums, get a general idea of where the implants are going to be placed. We're actually going to mark them with a Thompson stick so that we can make sure that area is very numb. At this point we're going to go ahead and dry off the tissue, apply some topical jelly to get the gums a little numb before we poke the guy. And in just a second here we will start numbing. Alright, so now that we've got the patient nice and numb, we're going to go ahead and start with the surgery. So first thing first, we are going to use a couple of anchor pins. These are 1.5 millimeter pins that just help stabilize the surgical guide. Once we've got a couple of those in place, we can start using the tissue punch, which is what we're doing here. So initially we will use the tissue punch with the surgical guide. Of course, that way we can make sure that we're making holes in the exact place that we need to. This will eliminate the need of making a flap, so the patient will be able to wear that denture a lot more comfortably. Post-op will be a lot better. But after we've got the tissue marked with the tissue punch, we're going to remove the surgical guide so that we can kind of rock the tissue punch around. Obviously, that crestal ridge is not a flat surface, and so the tissue punch is not going to work that well if you try and just use it with the surgical guide. You really need to be able to kind of rock it around. And so at this point, our tissue punches have been complete, so we're just going to pop off these little perfect circles of tissue so that we can get started with the implants. Moving along, so our tissue punches are done. We've got 6 perfect little circles for implant placement. We've got our surgical guide reseated on the tissue, and we are ready to rock and roll. We are using the Nobel Active Guided Surgery Kit, so we're going to follow the drilling sequence. We'll go through all 6 sites, first with the 2mm pilot drill, using a key, and then we'll go on to the 2.8 and then the 3.2, and then lastly use the soft bone tap. And so once that's done for all 6 sites, then we'll go through and place all 6 implants. Alright, so all 6 osteotomies have been completed, and we are going to first manually insert the 6 implants, and then we'll basically just kind of hand tighten them, get them seated all the way, and then once all 6 have been placed, we will go back and actually torque them to spec. So we're looking for about 35 to 45 Newton centimeters of torque here. And his bone is actually fairly dense for maxillary. And so we feel very confident at this point of the surgery that we will be able to immediately load those implants with the denture. This is also a good time to point out that the patient is, fully conscious. He's just numbed and laughing gas, but no oral sedation or anything like that. So he's completely aware of his surroundings. From the time that he sat in the chair till the time that we finished the 6 implants, probably about an hour and a half, he was able to watch Rush Hour with Jackie Chan and Chris Tucker, oldie but a goodie. And he's having a good time. He's laughing. He's making jokes with us, giving us thumbs up. But he's comfortable. This guy is an ideal patient in every way. Just super easygoing, happy, easy to work on. He knows when we need him to open and when he needs to bite down and all that good stuff. So definitely having a great patient like this helps make the procedure go a lot easier and a lot more smoothly, especially with no sedation. Alright, so at this point we are coming towards the end of the surgical portion. All 6 implants are in place. We're just checking the torque value, which is looks like anywhere from about 45 to 65 Newton centimeters, which is great. And now that the implants are all torqued down, we are placing multi-unit abutments with a varying collar height and an angle. It's kind of a mixture of 17 and 30 degrees in this particular case. When we do the implant planning, we try and get the implants as parallel as possible, but as we all know, that's not necessarily the ideal exit angulation for an all-on-4. So these multi-unit abutments are great for that. And here we are placing, these are temporary copings for the multi-unit abutments, and this is what we're actually going to use to attach the denture. So this is quite a bit of a process of just making sure that we have passive clearance, and then we'll trim those down a little bit, clean up the denture, trying it back in the mouth again. Repeat a couple times. I think it's probably a good idea just to do 1 or 2 of those copings at a time, just to make sure you're getting a good passive fit, and then move on to the next one. And then once all 4 are done, just make sure that you're not hitting anywhere. So now that we've got a good passive fit, we're going to go ahead and just use a little Sharpie and mark those copings roughly where they need to be trimmed down to. Of course, obviously we don't want any of that metal poking through on the palatal side of the denture. So we're going to trim those about 1 or 2 millimeters below the palatal tissue on the denture. And now that those are trimmed down, we're going to use a rubber dam, and this is mostly just to ensure that we don't get any acrylic or anything else under the gums into the implant site. Of course, we don't want to do anything that would irritate the implants, especially during the healing phase. So this rubber dam is a great way to make sure that stays clean and dry during this process of filling in the holes with acrylic. And so before we fill in the acrylic, we need to make sure that we use some light body inside those copings so that acrylic doesn't get in there and block off the screws that attach it to the multi-unit abutment. So light body is a great choice for that because it's easy to pluck out. It usually comes out in one nice solid piece, so it doesn't kind of fall apart. I guess Teflon tape would be another alternative, but it's a little more difficult to work with. So now we're going to go ahead and use some chair side acrylic. This is the same stuff that we would use to place locator housings into an overdenture. And now that's cured, and so we're going to go ahead and kind of clean up the backside of any flashing that has made its way through. Something that we've learned is that you can use these little multi-unit protector copings that Nobel offers, so that way you don't have to worry about damaging your copings that you've just placed in there, which will definitely cause an issue when it comes to fitment. So here's the proverbial moment of truth. We're gonna try this denture that we've just modified. So at this point, all the holes have been sealed up, other than just allowing the access hole for the screw. So aside from just some anticipated adjustments to possibly bite or edges that may possibly feel a little bit sharp on the patient's tongue or palate, this is when we're going to find out if this denture fits properly the way that we anticipated it, and calculated that it would fit based on implant placements with that surgical guide. And looks like everything is fitting well, not having any resistance with the multi-unit abutments. So now we're just going to go ahead and torque down these multi-unit abutments into the copings, and these get torqued down to about 15 Newton centimeters. And very important that we keep an eye on how much torque they're getting, because these are pretty tiny little screws. All right, and after just a couple of quick adjustments to the bite and closing up those holes so that food and stuff doesn't get stuck in them, we're going to set the patient up and see how everything feels. At this point, taking our time, keep in mind, the patient has been in the chair for probably between 5 to 5.5 hours. Again, conscious the entire time, just numb. But one of the benefits of having the patient conscious and not being under sedation is that we can sit him up and let him kind of chew and talk and see how he's feeling. So let's see what he has to say. All right, so I'm in video right now. So how do you feel?
Oh, it feels great. Lot better. It's very solid now.
So we just placed 6 implants and attached your denture, and you can still talk and smile, and you're not in pain, no crying, no screaming, nothing like that.
Oh, everything feels great.
How's the surgery overall?
Oh, tell the truth, I was concentrating on the movie.
Awesome, that's what I want to hear. Cool, good deal.
Sir, and so you had your 6 implants placed last week. I believe it was Friday, right?
Thursday.
Oh, Thursday. And it's Monday, so it's been a few days. And how are you feeling, sir?
Oh, it feels great. It's close to natural as I felt in years.
Wonderful.
A couple of years.
Wonderful, wonderful. So yeah, he's looking great. He had a little bit of swelling, but he said no, most of it has gone down.
Yes.
Still a little bit of swelling, but but definitely feels a lot better. Not having a denture that you take in and out on the top, right, and that it's fixed right now, and then we're going to be doing permanent bridges, or a bridge up on the top, and then he has his lower implant retained denture on the bottom that snaps in. But other than that, he's a happy camper.
Well, yeah, not having the palate there.
Yes, sir.
I can taste my food again. It doesn't gag, anymore. It doesn't. There's no movement.
Wonderful.
It's as close to real teeth as I've had in a while.
Wonderful. If you can smile for me, sir. Yeah, looks good. Well, wonderful. Thank you so much, sir. I appreciate it.
You're very welcome.
Thank you.